In the United States, we typically follow the American College of Obstetrics and Gynecology's two-step approach for diagnosing gestational diabetes. What this means is that there is an initial test, which is a 1-hour glucose challenge test, where you drink a glucola, a glucose drink, and then have glucose tested following that 1 hour later. If you fail that test, meaning your glucose was higher than the threshold, you will be asked to return for a 3-hour glucose tolerance test where they measure your glucose before the test, and then you drink a different shake with a different amount of glucose in it, and they measure your glucose at 1, 2, and 3 hours following that. For that test, typically women need to fail 2 of the 4 glucose values to be considered gestational diabetes. Glucose tolerance tests can be a little bit confusing to do and go through, and sometimes are not the most fun thing to do, but are really important and provide a lot of good data that your physician can help interpret in terms of diagnosing gestational diabetes. You may wonder if your first 1 or 2 checks are fine, why they would want you to stay for the 3rd and 4th checks. It can be really important because there are variations in absorption from your stomach and GI tract of the actual shake, like when the peak glucose will occur. In some patients, that can be later than in others. So it is really important to have all 3 of those markers. In diabetes management, we actually often look at 1 hour after a meal or even 2 hours after your meal, how that glucose is compared to a normal glucose level. So it's really important for us to get that complete set of data to interpret. Typically, gestational diabetes does not have any symptoms. So some of the symptoms of higher blood sugar that we see in pre-existing diabetes, such as increased thirst or urination, typically are absent in those with gestational diabetes. So that's why it really is important to screen every woman in pregnancy for gestational diabetes. In the first trimester of pregnancy, it's recommended to test the glucose of anybody that has risk factors for developing gestational diabetes, including a family history of diabetes, a prior pregnancy with gestational diabetes. If they have other concerns or diagnoses such as polyendocrine metabolic ovarian syndrome, it is recommended to get screened early in pregnancy for diabetes.